Hi, we will be talking about good communication versus bad communication. The compilation has been made by Mrs. Hansa Joshi, member of National Association of Palliative Care for Ayush and Integrative Medicine, Gujarat chapter. Communication, we all know, is fundamental to existence as well as survival. It is a process of creating and sharing ideas, information, views, facts and feelings to reach a common understanding. Effective physician-patient communication is an integral part of clinical practice and central in doctor-patient relationship. A friendly manner and rapport with the patient are a win-win situation in the practice of the art of medicine. Though knowledge is important, good communication skills earn the doctor more brownie points than a long list of degrees. Medicine is an art whose magic and creative ability have long been recognized as residing in the interpersonal aspects of patient-physician relationship. Having said that, good communication skills will help the physician navigate the complex journey of strong emotions, stressed families and uncomfortable conversations with ease. Every patient needs to talk to the physician because of some physical or mental problem. It may be embarrassing or downright scary for the patient to discuss something so personal with the physician. But if the manner of the physician is friendly, open and empathetic, the patient is put at ease. Even while breaking bad news, the empathetic nature and reassuring tone of voice will be indicators of genuine concern. Setting aside a time slot without interruptions and putting the patient at ease by answering queries conveys to the patient that the physician cares and has time. Such a patient is more likely to be satisfied with the care, share pertinent information, follow advice and adhere to the prescribed treatment. With regards to the above, says Mrs. Hansa, I would like to share a personal experience. She is sharing her experience that this happened to her in her second trimester of pregnancy. Since her gynecologist was far away, she decided to go for a routine sonography to a local sonologist who was well qualified and had state-of-the-art equipment. After doing the sonography and before she could get up and dress, he casually said that there was a problem with the SD ratio, which meant the placenta perfusion was inadequate and that there could be physical or mental retardation in the baby. She was stunned. This was a routine sonography, so she thought all would be well, since she had no symptoms. The sonologist was so nonchalant as if he was discussing the weather. She was very upset when she spoke to her gynecologist over the phone. She reassured me and advised me to go to another sonologist with whom I followed up over the next few months. He was extremely caring and very professional. At each session, he reassured her that the problem was sorting out and that all was well with her baby. Ultimately, it was a good outcome, but she could go through the stress only because of his gentle and caring manner. Also, he discussed every sonography with her gynecologist and put her at ease every single time. This was her experience as a doctor. She shuddered to think of what the lay people may be going through during such trying times. She went through intense training in communication skills before passing the PLAB UK and USMLE US examinations. During that time, there was no formal course in India. It was then that she realized how important it is for all doctors to cultivate these skills. Hope her first-hand experience of bad communication skills of a fellow colleague is an eye-opener to all of us in our endeavor to better ourselves and give of ourselves for the benefit of the patients. Wish you all the very best in your journey of communication. Thank you.